It's Plastic Surgery Secrets Talk, the podcast where we have the latest and greatest and most secret information in facial plastic surgery, and aesthetic medicine. I'm Dr. Jeffrey Spiegel from the Spiegel Center in Newton, Massachusetts, and I'm so happy to be speaking today with Dr. Kian Karimi from Brentwood, California in Los Angeles, a well-known and respected facial plastic surgeon and a leader in should we call it advanced healing methods and biologicals? What would we call this category?
I would call it regenerative aesthetics.
Regenerative aesthetics. Okay, so let's talk about regenerative aesthetics. So in the past, we had sunscreen, which is still important, and then we have certain topical chemicals like retinols, and then people got deeper, and you could inject in originally dermis and then hyaluronic acid, and then we have things like Sculptra and Radius, which are biostimulatory and have some effect at producing a reaction from your body that really produces more of yourself. But now there's a next level. Is that a fair way to say that?
That's right. That's right.
So what is this?
So we're all looking for the fountain of youth, and we all, as humans, we have cells that are able to regenerate and repair wounds and to heal. We have that ability. And so really it comes down to platelets. It's kind of where I've been focused on in terms of research and development.
Now, platelets are for clotting.
Well, that's what we learn in medical school. But the real secret is that platelets do a lot more than clot. They actually are full of growth factors that can promote collagenesis, wound repair, elastogenesis, and recruit other cells in your body to create a desired response.
So that's how they stop the bleeding, right? Like they get there and they plug up the hole and then they release their special mediators and your body produces something.
That's right.
To heal that area.
That's right.
And it has to do it fast.
It does, exactly. And so platelets have come a long way. I mean, in 1998 was really when the first time the dentists and oral surgeons described concentrating platelets to heal teeth and jaws, and that was PRP. That was like the first iPhone, basically. Now we're at like iPhone, 15?
Yeah, I have a Samsung. I'm embarrassed to say that.
But so basically now the aesthetic field has just exploded, and people, whether you love it or hate it, are getting more toxin and getting more fillers. But there's a lot of people kind of waiting in the rafters for an all-natural option to treat. And I think this is where regenerative aesthetics truly comes in.
So getting your body to do what you want it to do.
Exactly. So basically, one of the things that I've spoken on and also learned at this meeting is that we can utilize our own blood as a blood draw and spin it certain ways and heat it, cool it, and whatnot, and use it as a biofiller. And I think for really popular areas like under eye circles and skin boosting, skin regeneration.
So the dark circles under the eye?
Yes, that's right.
So you can get dark circles under the eye to look better by putting in blood.
That's right.
And now, why aren't you going to get darker circles? Because people have a bruise. Yep. Tell people why that's the case. This is one of the secrets. Pay attention.
So that's a great question.
Turn up the volume.
So we actually make sure that the red blood cells are out.
So those are the problem.
That's the problem. So we don't want the red blood cells for this use. So the centrifuge, which is the device that spins the test tube, makes sure that the red blood cells are out. So we're left with the platelets. But the platelets are in their natural environment surrounded by their matrix called fibrin.
And so then the fibrin helps the platelets to do their thing, right? It kind of turns them on.
That's right. So it forms a little web for the platelets to kind of stick around, and that allows it to gel right away. And then the platelets, just like if you were to cut yourself, slowly release their factors.
So tell me some uses for this.
Yeah.
I know there's been some talk, and I wrote a paper on using these kinds of things to help grow hair.
That's right. So hair is definitely one of the areas that you can utilize this for. So you can inject right into the scalp, where the hair follicle lives, usually about millimeter and a half deep. And again, PRP can be used for this as well, but I do think that the PRF is very effective for hair growth.
And what else? So it's skin rejuvenation.
Skin rejuvenation. So after very popular procedures like microneedling, or there's some devices that will, like radio frequency microneedling.
Sure, like the Morpheus machine.
Yeah, like Morpheus and others, that you can apply it topically to heal faster and to get more of a boost of collagen that the other procedures will. It really is a synergy.
So it supercharges it.
Exactly.
How long do you need to leave it on your face for?
10 minutes.
So
15 minutes.
for 10 minutes after the procedure, you're going to massage this stuff into your skin.
That's right.
Does it heal faster in addition to working better?
It does, and it's hard to do, we call split face studies because the cells all kind of communicate with each other. But the studies that have been done, looking at PRP and PRF on wounds after lasers, that wounds that we create or just wounds that are there, does suggest that it will heal faster.
So now, what about instead of taking this out of my own body, why can't I get this off the shelf? I see exosomes on Amazon and I see exosomes at meetings. Tell people what's up with exosomes.
So we all have exosomes in our own platelets, but when we do platelet therapy, we're not getting a super high concentration of exosomes. Now we've had this flood of exosomes in our market, like you mentioned. You get it from Amazon or Alibaba. It depends on what you're into.
They come out of roses, out of plants, out of people, out of animals.
And the issue I have with it is that there's just so much noise in terms of where are these exosomes coming from, right? And how do we know? Does it need to be frozen? Does it not need to be frozen? Can we apply it?
Are they still alive? Are they still working?
Right. And the other issue I have is that the exosomes that come from people have genetic code from other people. And to answer your question, the reason why you can't use someone else's blood is because our immune systems will potentially reject
it.
Yeah.
So what's the future? Like, what do you think is going to be here in 5 years? Are we going to be mixing PR something with exosome something, and is this going to obviate surgery? Is surgery going away?
Surgery's not going away. There's no, otherwise I'm out of a job. But actually, there are certain issues, when we change the shape of someone's nose, or if someone has really advanced signs of aging. What I think is going to happen in the next 5 years and beyond is that we're going to be, most of us are going to be talking more about wellness, longevity. How do we optimize our own body even before we do any of this stuff? Okay, and there's a whole science on anti-aging and
health and wellness.
Yeah, health and wellness. In terms of devices, injectables, platelets, I think, are still going to be part of the conversation. And how do we optimally process those platelets to utilize either as a filler that can last maybe 6 months, 12 months? That would be nice. Then we don't have to buy anything off the shelf, right?
That'd be great.
The devices that are coming out that I think are also exciting are the ones that can vibrate the tissues without destroying cells. We've been in a cell destruction mentality.
Creating a scar to tighten.
So the devices that are coming out, because we love technology, right?
When it works.
Yeah, when it works. And so the devices that are coming out now are really making sure that we don't destroy cells. So how do we get things to work without destroying cells? Well, there's vibrational sound wave technology, there's electrical field stimulation, there's a combination of the two. So a lot of exciting stuff in the works.
That's wonderful. So a lot of good secrets today. Your blood, when put in the right place, can do marvelous things. And it's just a matter of using nature to enhance nature. But it's not going to eliminate surgery. It's only come so far. But you can delay it. If you start early and keep up with things, you're going to look best for a long time. Dr. Karimi, it's been so great having you on the show.
Spiegel.
If people want to get in touch with you, how do they do that?
My Instagram is the best way, Dr. Kian, DrKian.
Okay. And I'm Dr. Spiegel from the Spiegel Center. You can reach us at Dr. Spiegel, DrSpiegel, on all your favorite channels. Tune in next time for another exciting episode of Plastic Surgery Secrets Talk. And don't share this information with others. That's how it stays a secret. Tell them to listen to the podcast on their own.